A vac dressing change. Obviously, we're going to pretend that this black necrotic tissue is not there. We're going to fill this area with the black foam. We're going to seal it off. We're going to connect the Sensitrack to it, as well as covered up with the Tegaderm. I'll show you just a couple other tricks that are not necessarily in the instruction manual. It's just something that I've picked up on. Given that this piece right here is supposed to be simulating an exposed tendon, so we're going to go with that we have an exposed tendon there. We don't want to put that black foam directly on that wound bed. So what I would probably do is I brought something.
There's lots of pretending.
Yes. So I brought this is like a Curel. Y'all seen it's a type of gauze. It is not a it does not have petroleum in it. It is oil emulsion. Okay, so just know the difference with that. I would probably take this little piece. Do you want me to go ahead and do sterile technique and all that right now with this? No. Okay, good. All right, we're just gonna pretend.
Really good at pretending.
Perfect. All right. So that being said, I would probably take a piece of this, just the size to cover the tendon. Easy cheesy. Doesn't have to be pretty. Nobody's looking at it. Okay. Put it over the wound bed. Over the exposed tendon. If that's bone we're looking at right there, cover that too. Good. Done deal. If y'all want, y'all can take this and just kind of feel it. It's gauze, and then it has the oil emulsion on it. That would be a type of dressing that you would need to use when you needed to add moisture to it. Okay.
Why wouldn't you want petroleum on it? You said it doesn't have petroleum or something?
That one does not. It's an oil emulsion.
Okay.
There are some gauzes that are impregnated with petroleum products. You just have to look at it to see what it is.
Okay.
There's a
put that on the leg.
no, you can.
Oh, okay,
you can.
you can.
Mhm.
Okay.
Again, you may need to go back to allergies, what they can have in the wound bed, like if they have any problems with that. Do they have petroleum allergies? You want to use an oil emulsion instead. And I also find that the oil emulsions with the gauze will tend to stay a little bit more moist than just the petroleum gauzes. The petroleum gauzes dry out a little bit faster. You can also, even with if it's a petroleum gauze or an oil, if you have a hydrogel or any type of, a lot of times they even just use like KY jelly stuff to add moisture to it, hydrogel, squirt it on there, take your fingers and ball it up and keep that moisture in there, and gives it even more moisture to hold in there for the wound bed.
You have to document everything that you put inside the wound.
Yes.
So that they know what they're taking out.
Yes, or what you need to take out.
Yeah.
Yes. So this is going to be our foam. So basically what I'm going to do, I don't have with me Skin Prep. Y'all seen Skin Prep? Any type of
Tense coat. It's kind of
yes,
like that.
it's like a just like a protective barrier. I always around the whole outside of the wound. Another tip that I would tell you is anytime you're going to use that, especially with Skin Prep, when you open it up, it is alcohol based, so you smell it. Tell your patient before you even open it up, because all they're going to smell is alcohol, and you're going towards their wound with something that smells like alcohol, and they're liable to kick you in the face, and you don't want that to happen. So tell them, hey, I'm about to open this. It's going to smell like alcohol. I am not putting it in your wound bed. It is just to help protect the area on the outside of it. Those also, you typically need to let them dry before you put anything on them. So you put that peri-wound protectant on there, let it dry. You don't want to stick anything to it while it's wet, because it's not going to serve its purpose. Okay. So we're going to pretend that we just put it all on the outside, the whatever it is, Skin Prep or the Tensicoat, whatever you use. You're going to take black foam, cutting it over here, never cutting it over the wound bed, because these little pieces fray off. We don't want to have any extra little pieces in there that we don't need. You're basically going to cut this the size of your wound, a little bit smaller, okay? You do not want to stuff as much black foam as you can into a wound bed. Why? What happens? All of those, all of it. So one, the more you put in it, the bigger it is, the more it compresses the outside of the wound bed. What happens when you compress the outside walls of the wound bed? What also are you compressing? The blood flow. So you compress the blood flow, now you've compressed the oxygen, now you've just made your wound ischemic, and so you just beat yourself up for nothing, okay? You just, anything that you're putting in the wound bed, you fill space. You're just filling space. Not as much as you can, you're just filling space, okay? Because we don't want to allow any open pockets to happen, and then you have drainage start pulling up, and then you have a whole nother abscess, right? All right, so I'm gonna go through and cut this. That's a quick cut. A little bit smaller than the wound bed itself. Yeah, I think I've done that before. There you go, right? Easy. So from that point here, I would tell you there's tricks to this stuff. It's like saran wrap. It's either gonna work really well for you or you're gonna hate it. So this is one big sheet, okay? You're never gonna do this. Don't do that. Don't put more on anybody else's outside of the wound. You wanna put the least amount of dressing on somebody that you possibly can. It's gonna irritate their skin, and you're gonna have to take it off later. That's not gonna be fun. So tricks with this thing, everybody remember 1, 2, blue. Okay, 1, 2, blue. You gotta do the strips. So basically what I would do from here is I'm gonna cut a square that's gonna cover up this whole area right here. The other thing that I will tell you while I'm doing this, I try to do a lot of this as much as I can, as quickly as I can, either before I take the dressing off of the wound, because when you take a dressing off of the wound, what happens? It gets exposed to air, right? So what happens? It's gonna what?
Dry out.
It's gonna dry out, but you're not gonna dry out a wound like that quick just from a 30-minute session. But what does happen is it gets cold, right? It gets cold. So then what happens when you get cold?
It constricts.
Your blood vessels constrict. Every time you expose a wound to air, it takes 4 to 6 hours for it to get back up to its normal body temperature. So think about how much of a reduction of oxygen that you're providing to that wound, keeping it exposed while you're trying to figure out what you're gonna use. So you always wanna kind of have a game plan ahead of time, okay? All right, here is number 1, and I still have number 1 here, okay? So I'm gonna go ahead and put me an anchor down here. This is not sterile. The inside of it is, because I'm taking the piece off, right? This is sterile. We want that to be sterile. But this is not. So I'm gonna go ahead and take my number 1 off here. I would have sterile gloves on here. You're gonna hold here. Bam, done, okay? Push out your creases, done. There's your number 1. Take your number 2 and go all the way across. You should not have green stripes still on your dressing. And here is your blue, okay?
What is that called?
This is like a Tegaderm or an Opsite.
Oh, okay.
It's just a clear. This is one with a pad. Like Tegaderm is a brand name. That's what I should tell you. Tegaderm is a brand name. Opsite is a brand name. This is a transparent. This is a transparent. That is your best bet to learn any and all dressings by what they are, not by their brand names. You will find people documenting brand names, and then you're gonna go into a clinic and you're gonna look for a common